Hi, my name is Zach Shell, and I am part of Group 4, along with Kimmy Sunny, Mary Sellers, Daisy Shelton, and Melikar Valentin, and today we'll be talking with you about pancreatitis. The pancreas is a large gland behind the stomach and close to the first part of the small intestines. It secretes digestive juices into the small intestines through a tube called the pancreatic duct. The pancreas also is involved with hormones such as insulin and glucagon to be released into the bloodstream. Pancreatitis is the inflammation of the pancreas. It happens when the digestive enzymes start digesting the pancreas itself. It can be acute or chronic. Either form is serious and can lead to many complications. Acute pancreatitis occurs when suddenly and usually goes away within a few days of treatment. It is often caused by gallstones. Common symptoms of acute pancreatitis include upper abdominal pain along with nausea and vomiting. Chronic pancreatitis does not heal or improve. It gets worse over time and eventually leads to permanent damage. For our case study, we chose a 50-year-old Linda C. who presented to our clinic with a sudden onset of mid-abdominal pain radiating up to her back. The pain awoke her this morning at 1 a.m., which caused her to vomit several times. The MSS did not relieve any of the pain. She takes 1 aspirin a day, does not drink any alcohol, or has any tobacco use. She has been told that she is predispositioned for diabetes. On physical examination, she had a blood pressure of 150/60, heart rate of 101, and respiratory rate of 24, and her body temperature was 38 degrees Celsius. There are crackles in the base of her lungs, along with tender abdomen, and also guarding and rebound tenderness. Bowel sounds were not heard in the lower portions.
There are two risk common factors for pancreatitis. It can be chronic or it can be acute. Acute meaning something that's just happened suddenly. We have gallbladder stones resulting from gallbladder disease. And also we have autoimmune. This is when the digestive system, the digestive enzyme that comes from the pancreatitis juice begins to digest the organ itself upon activation. This may be due to blockage of the biliary duct, when it can't flow, so they start digesting themselves. Also, smoking. Smoking can predispose anyone to pancreatitis, destruction of the pancreatitis lining. Also, metabolic disorders such as the hyperparathyroidism, when we have excessive thyroid hormone, when they start hyperactivating and they produce excessive hormones, this could cause a metabolic problem that will also lead to pancreatitis. Also, we have the peptic ulcer, the erosion of the gastric lining will also transfer to pancreatitis. We have idiopathic, which is unknown. It just happened and we don't know what happened. You don't know how it happens. Medications such as thiazide could cause pancreatitis. Also some antibiotics could lead to that. We have trauma from post-surgery or from lipidemia, high fat in the content, and also infection. The chronic one could be from alcohol use, long-term alcohol use, not occasional, long-term alcohol use. And also hereditary factors, like children that have cystic fibrosis, they could have hereditary pancreatitis in pancreas divisum. In summary, risk factors of acute pancreatitis can occur in any patient with history of gallstone disease or they have heavy alcohol consumption. Also, it could happen in men between 30 and 40 years. It can also happen to women too, but it affects more men than women. And they have long-standing alcohol injection. Inflammation of the pancreas, pancreatitis, occurs when there is an excessive or chronic alcohol intake. It can also be caused from hyperkalemia. A scorpion bite can induce pancreatitis. There's also a hereditary pancreatitis syndrome. Ultimately, what happens is the liver releases AST and ALT. The bile duct then releases alkaline phosphate. With this inflammation, the pancreas releases amylase and lipase, which all elevate and create pancreatitis. Signs and symptoms from this cascade of happenings is abdominal pain, upper abdominal pain that can radiate to the back, an increase in abdominal pain with food intake, possible fever, nausea, vomiting, and upper abdominal pain with palpation.
This is Melly Carvalentone for our Group 4 presentation on pancreatitis. The pancreas is a gland located in the upper posterior abdomen, which functions as one, an endocrine pancreas, and two is an exocrine pancreas. The functions of the endocrine pancreas is for insulin production and constitute about 20% of pancreas work. And this is also found in the islets of Langerhans. The pancreas functions as an exocrine pancreas, which produces and secretes digestive enzymes and which helps in the metabolism of nutrients. These are made up of the acinar cells. The exocrine pancreas constitute about 80% of the work that the pancreas is to do. In relation to our patient Linda C., the type of pancreatitis that she may have may be related to acute pancreatitis due to the initial onset of her abdominal pain radiating to the back. Part of the pathophysiology of pancreatitis, it starts as an acute pancreatitis, which is usually caused by an injury to the pancreas, which then leads to inflammation. The inflammation of the pancreas happens for an prolonged period of time, produces chronic pancreatitis. It creates scar tissues, calcification, and pancreatic duct dilation. The incidence of chronic pancreatitis range from 4.4 to 11.9 per 100,000 persons per year. Men are about 1.5 times more likely to develop chronic pancreatitis than women. Other types of pancreatitis include hereditary pancreatitis, which peak at the age of 10 to 14 years, juvenile idiopathic chronic pancreatitis, which peak at the age of 19 to 23 years, alcoholic pancreatitis, which peak from 36 to 44 years old, and senile idiopathic chronic pancreatitis.
Treatments and outcomes for acute pancreatitis would initially start by evaluating the etiology of the attack. The goal of the treatment is to stop the autodigestive process and prevent systemic complications. Narcotics, NSAIDs, acetaminophen are used to treat pain. IV fluids would be used to prevent hypotension and shock. For the nausea and vomiting patient, a possible use of the nasogastric suctioning to alleviate pain and to prevent a paralytic ileus. Severe cases, you could expect to see enteral nutrition be initiated. One would also see H2 receptor antagonists used to decrease gastric acids, antibiotics if infections were present, surgical intervention with those with necrotizing pancreatitis. Outcomes vary according to the etiology and the damage of the attack. The prognosis is good for the mild attack.
of pancreatitis. Complications with severe cases can lead to an ICU stay, additional intravenous nutrition, and at times can lead to death.
Summary of pancreatitis. Pancreatitis is a rare disease in which the pancreas becomes inflamed. Pancreatic damage occurs when the digestive enzymes are activated and begin attacking the pancreas. In very severe cases, pancreatitis can result in bleeding into the gland itself. Serious tissue damage, infection, and fluid collection may occur. Severe pancreatitis can result in damage to other vital organs such as the heart, lung, and kidneys. There are two forms of pancreatitis, acute and chronic. Acute pancreatitis occurs suddenly and may result in life-threatening complications. However, the majority of patients, 80%, recover completely. Chronic pancreatitis is usually the result of long-standing damage to the pancreas from alcohol ingestion. Chronic pancreatitis is primarily marked by severe pain and loss of pancreatic function. Continued summary for pancreatitis. Prognosis for chronic pancreatitis tend to become more severe over time, and overall 10-year and 20-year survival rates are estimated to be about 70% and 45% respectively. Patients with chronic pancreatitis are at an increased risk of developing pancreatic cancer. Prognosis in acute pancreatitis usually improve independently or when dietary changes are made. Patients' outcomes are often very positive, and people usually make a full recovery. Alcohol intake should be eliminated. Smoking should be stopped because it acts as a stressor to the body's defense mechanism against inflammation. In cases where gallstones are identified as the cause, the gallbladder is surgically removed to prevent any further episodes. Ranson's prognostic signs can be used to predict the patient's prognosis. One of the studies authors Dr. Mark Truly describes the chemotherapy before surgery can be beneficial and improve survival in some patients with pancreatic cancer. 5-year survival is currently around 7%, and less than 20% of patients are currently able to have surgery, the only potential cure. At the end of the trial, patients who were originally given 12 to 18 months to live had increased survival time of an average of 4.9 years. Thank you.